joining us. And here we go for our first webinar at Chicago Integrative Movement Specialists. Just an important disclaimer before we begin. So the information contained herein is not intended to substitute for professional medical advice, diagnosis, or treatment in any manner. Always seek the advice of your physician or qualified healthcare provider with any questions you may have regarding any medical condition and before engaging in any physical activity. Discontinue any exercise that causes pain or discomfort and consult your qualified healthcare provider. So when I first started, I'm going to tell you a little bit about my story before we begin and why the shoulder is very near and dear to my heart. When I was about 15 years old, I was quite a little scrawny kid. So I was about 5'10", so basically the same exact height I am now. And my head was pretty much as big as it is right now. And I weighed about 120 pounds. So for my birthday, I think, or maybe it'd been Christmas, I got one of the best Christmas gifts or birthday gifts that I had ever gotten up to that point. And this was my first coach. I got the Encyclopedia of Modern Bodybuilding, and Arnold was pretty big back in the mid-1980s still. He was just coming out as a Hollywood star. And of course, like any aspiring bodybuilder at 15 years of age, I wanted to be like Arnold Schwarzenegger. So I read his book and took his advice and basically did the exact same thing that he's demonstrated in the book. And I didn't really realize or understand how exercise worked. I didn't understand things about steroids. I didn't understand things about being a professional bodybuilder. But I copied what he did because he was the expert in it. And in the process, I started to lift a lot of weight. I got pretty darn strong. And I remember growing up on a farm, and I did a lot of manual labor my entire life. So I cut wood, split wood, used chainsaws, axes, hammers, sledgehammers, worked on a farm, baled hay, did all the things that you do on a farm in active life. I never had an injury in my life until I started doing bodybuilding style workouts. But that's what I did, so I just kept doing it. I went to chiropractic school, and again, I got stronger and stronger, feeling pretty good about myself. However, I started getting worse and worse shoulder problems. And I did all the rehab exercises I got taught in chiropractic college, as well as when I went to physical therapy. And my shoulders still continued to get worse. So today, this is what my shoulders look like. So you see the backside of my shoulder there is a big divot in my shoulder. And that's because my shoulder is very hypermobile now because of all the things I learned how to do, many of them not so great. So you do not want your shoulder to have a divot in it like that. Because what that means is that your shoulder is starting to pop forward in the socket and you have lost integrity of your shoulder. So I have labral tears in my shoulders and rotator cuff problems in my shoulders from years and years and years of doing poor exercise technique and from doing physical activity as a chiropractic physician. So the quest to learn about the shoulders was very much a personal quest. And that's basically the information that came out in my book, The Corrective Exercise Solutions, which was written about 5 years ago now, because I needed to learn how to fix my own shoulder because I didn't have the time or the availability to be off from work because of shoulder pain and the surgery to fix labrum tears, which takes about 6 months at the minimum. And I would need both sides done. So I'd be out of work probably for over a year. So the information I'm going to share with you is information that I have used myself to avoid having surgery, to continue to be active. And there's many things I cannot do as in relationship to my own shoulder issues, but I have fully functional shoulders and I could continue to work out and be physically active as a chiropractic physician. And it's the same things we teach our patients and clients in our office at Integrative Movement Specialists. So I'm very excited to share this information because, like I said, it's a very personal nature to myself and has helped so many of our clients deal with their own shoulder issues. At Chicago Integrative Movement Specialists, we have a very specific mission, and our mission is to create awareness, educate, and empower our clients to take control of their health and wellness so that they may participate in the activities they need to, want to, and love to do. So that's really what we live by, and it's really what we do as whether we're working as a chiropractic physician, whether you've seen Janice as a massage therapist, manual therapist, and or Sarah as a movement specialist as well. We really want to empower you as a patient and or client. And if you're listening to this webinar and you're not currently a patient or client of ours, this is really how we work and why we do what we do. So all of the things we do is to help our clients and individuals do the things that they want to do. So this information is in 3 parts. One is we're going to teach you about the shoulder so you have a basic understanding how the shoulder works. 2, to show you how we first developed shoulder stability how each of us first developed shoulder stability. And then finally, what are some exercises you can do and what are some exercises you can avoid, because it's just as important to avoid exercises that will create problems as it is to do the right exercises. So the 3 goals of today's webinar is the 3 things you want to know about the shoulder, 3 exercises that you want to do to help improve shoulder function, and 3 exercises to avoid. And remember, as I said, if you've worked with us in our clinics, a lot of these things will be very familiar to you. If you have not, remember to always check with your healthcare provider before doing these exercises to make sure that they're appropriate for you. Here we go. So why do so many of us have shoulder issues? And it really comes down to one word. So if we think about all the reasons why we have shoulder issues, it comes down to one specific reason. It's our habits. So I guess that's actually 2 words. It's our habits. It's how we sit. It's how we stand. It's how we exercise. It's how we live our daily lives, whether we're working at a desk, whether we're working on our cell phone, whether we're participating in a certain activity, sport, and or occupation that doesn't include sitting. Perhaps we're in a standing profession and or we have a physical job. It's our habits that create and therefore dictate how we function. Other things like postural habits, also things we've learned from our parents, teachers, coaches, things we've read on the internet and or heard from our medical doctors and or physical therapists and or chiropractors about posture. A lot of these things contribute to how we have developed our habits, and our habits then dictate how we function in everyday life. And if you experience your own shoulder habits or shoulder problems like I did, you probably then developed also some non-optimal posture and or movement habits. So we're going to talk a little bit about a few of those in here and then help you develop more optimal habits around some of the exercises that we'll discuss later on in this webinar. So first, let's look at the anatomy. So very basically, the shoulder is a complex. So when we talk about the shoulder, we're looking at several bones and joints. But the 2 that you're probably most familiar with are the ball and socket. And if you look here, this is the backside of your left shoulder, and there's a ball. So that's your arm or your humerus. And here's your shoulder blade or your scapula. So this forms a ball, and then there's your socket. And then you have the shoulder blade sitting on top of the rib cage. That's another joint. So we have the 2 of the major joints of your shoulder are the ball and socket. And that's where the rotator cuff muscles, they sort of come in here and attach and connect the ball to the socket. And you have the muscles that control the shoulder blade upon the rib cage. And this is where most of the magic happens, is what is happening with the muscles that control the shoulder blade on top of the rib cage. We'll talk a little bit about that as we go along. So, optimal shoulder posture promotes optimal shoulder and neck health. So when our shoulder blade is sitting optimally upon the rib cage, we have optimal shoulder function and ultimately neck function, because what I want you also to appreciate is how many of the muscles that come off your shoulder blade also attach into your neck. So what happens at your shoulder impacts your neck, and what happens in your head and neck impacts your shoulder. So these 2 areas, including your rib cage, so basically the 3 areas, the head and neck, the rib cage, and the shoulder, all play off each other, and they're all vital to the health of each of the additional regions. Now, the one thing I want you to take a look at in this image here is the position of your shoulder blade or the scapula sitting on your rib cage. And this is approximately where it should be sitting. When it's sitting here, you generally will have optimal shoulder health and less decreased incidence of rotator cuff problems and neck tension and mid-back issues. So just think of the shoulder blade as just slightly rotated upwards. So you see how this finger here, my bottom finger here, is more to the outside of this finger, the top finger here. So this is slightly rotated up, and that's important because this promotes optimal health of the shoulder and ultimately of the neck and the rib cage. So when we have optimal posture, it promotes optimal positioning and control of the shoulder, head, neck, and rib cage area. Now, there's 2 postures that ultimately create many problems for us. Now, we have a slump posture, which is that sort of posture, and we see many individuals. Their head is slumped forward, shoulders are slumped forward, their belly looks a little distended, they have a big arch here in their mid-back, and they have another arch here in their low back. So again, we're very conditioned to look for that posture. And we know when we see that posture, yeah, that's not really great posture. However, there's a second posture that is equally as challenging for our shoulder health, and that's this posture here. So we see this individual here. So she's slumped here, and now we see her here. You're like, oh, that's much better posture. But here's a challenge with this posture. She's slumped here. Here, she's extended. The problem is most individuals that have this posture here, they have non-optimal posture the opposite direction, meaning that they've actually overcorrected their posture. So what this person has done here is she's straightened, she's lost the curve of her neck, she's lost the curve of her thorax, and she's increased the curvature of her low back. So it looks better than this posture. Like nobody looks at this posture and says, hey, I want to look like that. I want to look more like that. The problem is this posture here on the right, the extended posture, is probably worse for your shoulder and your neck and your low back than that posture there. This posture is not great. This slump posture is not great either. This posture is actually more damaging, and more people will have problems quicker and easier with this extended posture, because what we're doing is we're reversing the curves of the spine, and it takes more effort to hold this posture to the right than it does to the posture to the left. So it creates more muscle tension, more joint compression, more irritation, and then the shoulder has to compensate for that, and that's ultimately what leads to a lot of our shoulder issues. So we want to find a happy medium between a slump posture and an extended posture. And if you've seen any of our videos in the past or you've worked with us in our clinic, you know that we never tell people to put their chest up, squeeze down and back with their shoulders, because that will ultimately lead to this posture right here on the right. That's this chest up, shoulders down, pull your abs in. That's not an ideal posture, even though it gets taught so frequently on the internet, at doctors' offices, and physical therapists' offices as well. We want to find a happy medium between these two postures that's somewhere in between, where we have more natural alignment, more natural curvatures, and it doesn't require so much effort to maintain. So each of these postures create forward shoulder posture. The reason you don't see it so much on this posture, because it's real obvious on the slump posture, the reason you don't see it here is because she's squeezing her shoulder blades back so much to hold her shoulders in the right position. And like I said, that will ultimately create issues for your neck and shoulder complex, because you're overusing muscles like they're not supposed to be used. So we want to find some happy medium between these two positions, and I'll show you how to do that later in this webinar. So the forward shoulder posture is really what we're paying attention to. And it's not just that the shoulder has come forward. If you look at this alignment here in my patient that has chronic shoulder issues and also neck issues, you see a couple things. Number one, you see this big slope of her shoulders, and you see this right shoulder is actually lower than her left shoulder. So the right shoulder is a little bit lower, and the shoulder blade is actually rotated and pulled down on this side. So let me pull up another image here. So that's where Sarah's standing here, and you see that there's a slight upward rotation when the shoulder is positioned optimally. This individual has the exact opposite position. Now, that creates a lot of tension right here in the upper shoulder neck area. And if you palpate, or if you feel your own neck, so reach up, put your left hand over your right shoulder, and now start to slide your arm along your shoulder blade towards your neck. And most of us will feel a knot right about here where my pointer is pointing. If you start to feel around the base of your neck and the base of the shoulder blade there, the top point of the shoulder blade, you'll notice a knot there. And this posture right here is a very common cause. It's because the shoulder blade has rotated and been pulled down, and that muscle right here in your neck has created a lot of tension to try to pull that shoulder blade back up so it is more in this position. We want this position here, like as Sarah's demonstrating here. We do not want this posture, because this will ultimately lead to a lot of our rotator cuff problems and those chronic neck tension issues that so many of us experience. Because here's two more of my patients. And you see this woman here, she has downward rotation, or that downwardly rotated position of the shoulder blade on both sides. And she's trying to lift her arms up, and you see it's still relatively downwardly rotated. This gentleman here, also you see that significant downwardly rotated shoulder. And you see like this left side looks pretty good, this right side is sort of floating on his rib cage. And that's, again, a posture because he's created too much extension through his back. He's that classic example of that extended posture that we talked about a little while ago. So both these individuals have that issue where the shoulder blade has started to rotate down. And what they've done is they start to do exercises where they start to squeeze these muscles between the shoulder blades, and that just perpetuates the problem. So that's why it's so important that we have just a basic understanding of how the shoulder works and to understand that these are not the muscles that we want to work to improve shoulder position and or shoulder control and or to get rid of chronic tightness and or trigger points, those little knots that we have in our muscles. So we want to actually go the opposite way with our shoulders. So here's your third key point for this webinar. How did we first develop optimal posture and movement? And this is a beautiful little picture. I mean, not just because my little niece is lovingly looking at me in this picture. I'm going to keep this picture for her, so if she grows up and starts to become a bratty little teen, I'll show her that one day, yeah, far a long time ago, you and Uncle Evan were pretty close and tight. But here she is at 6 years of age. She's pretty darn cute still. If you notice something about her shoulder blade right here, she's got beautiful alignment of her entire core. And this is what we really want to focus on too, because your core sets up proper shoulder function. If you see the shoulder blade right there, her shoulder blade is nice and snug in the upward rotated position. So that rotation along her shoulder blade, so that she's stable, her shoulder blade is nice and stable upon her rib cage. And that's how she can flex her little muscles here. She's got pretty good muscles for a little 6-year-old there. She's giving us a little fashion show here of these clothes we just bought her. So she's real happy there. But you really get a sense of this is how we first started to develop. And this is what we want to get back to, because that's when we had optimal posture and movement. Before we got influenced by our habits, before we got influenced by well-meaning coaches and parents and teachers, before we started to read books and the internet and started to do exercises that took us away from what optimal actually is. So what are the 3 keys to this development right here? We refer to them as the ABCs. The A of the ABCs is alignment, and it starts with the core. And these are 2 excellent examples of perfect core alignment. You see how the rib cage and the pelvis all line up together, and you see this beautiful picture here of this baby here. I love this picture because it really shows you how we should be aligned. The head and neck stacked over your rib cage stacked over the pelvis. And there's one additional thing we'll notice here is if you look at her belly here, so you see this baby's belly right there. You see she's not squeezing her abs in or pulling her abs in. She's not trying to flatten her back. She's not squeezing her tushy here either. She just lets the belly be. Oftentimes, when we try to have our clients, or when we start to we've been taught to use our core, we get taught to pull that belly button in. And we never did that as children. That is not an optimal strategy for stabilizing the core. That's something that we adopted, and it's actually not 100% an accurate habit to create for core stabilization. Babies never pull their stomach in. They use their abdominal muscles, but you never see them actively pull their belly button towards their spine. So that's another reason I really like this picture, because it shows us where optimal alignment should be. You see she's got a little toy phone in her hands there. So she's probably going to start that process of bringing that head and shoulder forward as well. But right now, she's got beautiful alignment, she's got beautiful core control, and she's not pulling her belly button in, and she's not squeezing her shoulder blades down and back. So the first A, or the A of the ABCs, is we need alignment of the core, so therefore we have alignment of the head and neck and alignment of the shoulder. The second component is B, is breathing. And why is breathing so important to our posture and our movement? There's 3 key things. Number 1, it helps you recruit the proper muscles. When we breathe properly, we're able to use the diaphragm, which is the muscle right underneath your rib cage. We get to use the intercostal muscles, the muscles in between your ribs, and we also get to use the pelvic floor, which is the muscle in between your sit bones, or the bones that you're sitting upon. That helps the blood. That's how we create proper core stabilization. That's how we get proper shoulder placement. It helps to align the shoulders. And you see my little niece here, she got perfect alignment of her shoulders. Her shoulders are down and wrapped around her ribcage where they belong. They're not squeezed down and back. They're not shrugged up. They're not rotated down. They're rotated in that position we showed on Sarah earlier. When you breathe right, you're allowed to you're able to relax the shoulders into the right position and use the shoulder muscles appropriately. When we start to breathe improperly, like shallow breath or chest breathing or excessive abdominal breathing, we start to recruit too much of the neck muscles, too much of the shoulder muscles in breathing, and that starts to pull the shoulders out of proper alignment. So breathing helps to recruit the proper respiratory or breathing muscles, and breathing also helps to align the shoulders because it makes you not overuse those muscles that you don't want to overuse in the breathing process. And it also helps you activate the core. And you know, if you've worked with us or watched our other videos, that everything we do around the core revolves around alignment and then breathing. Breathing is what creates proper core stability. It's not about squeezing, bracing, tightening muscles. It's about breathing right so that you can activate those muscles that are deep inside your trunk and spine to stabilize your core. And again, that's why babies don't pull their belly buttons in, and that's why we don't teach our clients to pull their belly button in and or squeeze their glutes. Now, the C of the ABCs is control. When we first started to develop control, when we started to crawl. Crawling is an important process to help create stability and control of the shoulder. So when we say control, we mean stability. There's perfect alignment and control of that shoulder blade, and you see the shoulder blade on his rib cage, again, upwardly rotated here. He's a happy little guy here. And you also see there's no belly button being pulled in. He's happy to keep his belly just stuck out like it belongs. And you see the beautiful alignment and control he has through his rib cage, through his entire core, as well as his shoulder. So alignment, breathing, and control gives us the proper core muscles and alignment, and it gives us the proper shoulder alignment. So that way we can integrate alignment, breathing, and control into all the things we want to do through life, through work, and through occupation, as well as sport. So when we have proper alignment, we have proper breathing, we have proper control, your shoulder functions the way it should. And that's really the principles of the integrative movement system. And that's how we look at our clients. We first look at their alignment, then we look at how they breathe, and then we look at how they control, and that's how we help them improve their posture and movement. So now that we understand a little bit more about how the shoulder functions, and then how we first developed posture and movement of the shoulder, now let's look at some quick, easy, simple things that you can do on your own to assess yourself. So there's two self-assessments that we'll use. First is a neck rotation. And remember I said earlier that a lot of the muscles go up into your neck. So a quick, easy assessment you can do on yourself. So as you're sitting there, what I want you to do is compare your neck rotation. So we're going to look at neck rotation and compare side to side. So here's Sarah. She's going to demonstrate side-to-side rotation. And what I want you to do is just monitor your own rotation. So turn your head to one side, turn it to the other side. Note, is one side more challenging to turn to? Is one side a little stiffer or tighter to turn to? Or does one side create a little discomfort as you turn it? Just take note of that side. Because what we want to do is, anytime you do an exercise, you always want to have a self-assessment. And that's what's cool about these self-assessments, is because when you do an exercise, your self-assessment should not change. And if anything, it should improve. Meaning, if you do an exercise, you do your self-assessment first, you do an exercise, and you recheck your self-assessment. So you've done neck rotation, you compare it side to side, okay, got how it feels. Now you go do some breathing. Now you stand up from your breathing exercise, you check your self-assessment, neck rotation, it should be improved. If you've done a good job with your breathing, your neck rotation should actually be improved, because what happens is you recruit the right muscles, you align the body in the right position, and your nervous system will give you more range of motion. And that's what's the beauty of the ABCs that we talked about a little while ago, is you will start to create better range of motion, better posture, and ultimately better movement when you respect those ABCs. So self-assessment is an easy tool to use to help create an awareness around how your exercise is impacting your posture and movement. So neck rotation is one. So you've noted on yourself which direction you may have limitations to. And if you don't have any limitations, that's great too. Now, another self-assessment we'll do more specific to the shoulder is we'll check side to side overhead motion. So we're going to look at four things. One, range of motion. How far can you actually move your arm? 2, ease. How easy is it to lift your arm? Note any areas of tightness. Do you feel any tightness in your shoulder, in your neck, or in your back? And of course, you're going to notice any amount of discomfort. So here's your overhead assessment for your shoulder. So you're going to gently wrap your hand around your rib cage and then raise your arm overhead. The reason why you want to wrap your hand around your rib cage is you want to monitor for rib cage motion. Your arm goes overhead, your ribs should move, but it shouldn't jump up into your hand, meaning like it pops up because you're overextending through your back. You should be able to raise your arm with very little change in your rib cage position. So Sarah will turn to the side, and you can see it from the side. And you notice her back does not move. She's slightly extending her spine, but you don't see a big arch in her back and no motion of her rib cage. That's your true range of motion. So turn to the other side and check it as well. And again, that's what pure shoulder overhead motion should look like. So take a moment now, stand up, check your own motion side to side. Notice if your arm or one shoulder has less range of motion than the other. And of course, you can always check both sides at the same time. Same thing, looking for range, ease, tightness, and or any discomfort. Because after you do your exercises, you want to see an increase in range of motion or increase in ease, less tightness, and or less discomfort. If you feel that the range of motion is more limited and or it's harder, you've created more tightness and or there's more discomfort after your exercise, then your exercise has done something that has compromised the integrity of your alignment, your breathing, or your control. Exercise should never decrease your ability to align, breathe, and or control. And the self-assessment is really your way of determining what impact your exercise is having upon your body right then and there. So that way you don't leave your exercise routine and be like, hey, you know what? My neck feels a little bit tighter, but it must have been my pillow I slept in last night. No, you know right away it was my exercise that caused my discomfort. Because here's one of the common things that happens is we go to the gym and we think we're doing good things in the gym, but our gym exercises are actually contributing to our issue. And I'll show you some examples of that coming up here in a little bit. So now that you have your self-assessment, you have the range of motion in your neck that's decreased, the side that's decreased, and you also have a side of your shoulder that may be decreased. You may have decreased motion and or tightness in both sides, but you probably have one side that's a little bit stiffer and tighter and or has a little bit more discomfort than the other. Now we'll turn to the exercises that we use to start to improve our shoulder function and ultimately improve our range of motion, the ease of motion, and have less tightness and hopefully less discomfort in the process. Now, one thing before we get to the actual exercises is it's very important how we cue ourselves into our movement and or exercises. Now, the old way of cueing your rib cage position or your spine position was to lift your chest up. We don't use that cue at all with anyone anymore. Here's a new cue that we use with our clients. Think long as you're being pulled up by a string from the back side of your head. So as you're sitting there listening to this webinar, I want you to imagine you have a string from the back side of your head. So actually reach behind your head, feel that bump on the back side of your head. It's actually called your EOP, your external occipital protuberance. Just fancy word, it means bump of knowledge in your head. So imagine there's a string pulling you from your EOP or that bump of knowledge up towards the ceiling. So it should gently bring your chin down and you should get long through your spine as if you're being elongated towards the ceiling. Much better cue, and it doesn't create as much compression as lifting your chest up. Now relax that. Now lift your chest up and feel what that does to your posture. Two different responses. When you lift your chest up, I will personally feel low back discomfort and compression. But when I think long as if I'm being pulled up from the back side of my head, it feels much easier, much more sustainable. And that's very important. We want posture cues or exercise cues to be sustainable. So we want to make sure that you can sustain it for a period of time without using a lot of muscular effort and or creating compression of your spine as you do it. Now, another common cue that we used to use is squeeze your shoulder blades down and back. So as you're sitting there listening to the webinar, squeeze your shoulder blades down and back. Now feel what happens in your shoulders, feel what happens in your neck, feel what happens in your back. Now keep your shoulder blades squeezed down and back and try to lift your arms overhead and tell me how easy that feels. And for most of you, it probably didn't feel very good. In fact, for me, it felt like it compressed my shoulder a lot. And that's a cue that I used a tremendous amount early in my career because that's what Arnold Schwarzenegger told me to do. That's what all my therapists told me to do. That's what I learned in chiropractic college. That's what I learned in all my rehab classes. Squeeze down and back. And that's what also led to a lot of my shoulder problems. So here's how we cue our clients now. Float your shoulder blades. So imagine that, now relax your shoulder blades. Imagine you have balloons underneath your shoulder blades and imagine you're filling up space, those balloons in the space underneath your arms. Or think about going wide through your shoulders as if somebody's pulling your shoulder blades wide apart. Now keep that idea and now raise your arms overhead. And it should feel much easier and freer to lift your arms overhead. And that's why it's so important that we're not teaching ourselves to squeeze shoulder blades down and back. We want to have space. We want to have freedom. We want our shoulder blades to float upon our rib cage. So try these cues when you go to do your exercises next time. And or if you're just working at your desk tomorrow, imagine you're just floating your shoulder blades and are going wide through your shoulder blades. And think as if you're being pulled long from the back of your head. I'm going to show you how to breathe here in a couple minutes so that way you can add breathing to these cues. Now, here's the 3 best exercises. This is really why you came. Now, the cool thing about these exercises is you can do them anywhere that you can lie down. You can also do them sitting up. So I'm going to demonstrate lying down because that's an easy place to do them and an easy way to get your body to relax. And it's easy to allow yourself to use the right muscles. However, you also want to take these ideas into the upright position. So the same things we do lying down, we'll reinforce in the upright position as well. So the first exercise is the happy baby with breathing position. And we call this the happy baby supported position. And the reason why we call it the happy baby position is because this is the position you saw my little niece in earlier today. And the first position that many of us, or I should say all of us, first developed optimal alignment, breathing, and control in. Lying on our back with our legs elevated and developing core control and our breathing. So we're always going to apply our principles that align breathing control, those ABCs, to this process. Now I'm going to turn on this video and allow you to see the process, and then I'll walk you through the process. So I'm going to lie down on the table, and the first thing I'm going to do is support my head and neck. If you see right there, that's the position that many of our clients are in with a chin up. So I want to support my head by a towel so that my head is in more alignment, more optimal. And then my hands will go upon my rib cage so that I can feel myself expand. Now the position is important as well. If you notice, my legs are up against the wall. I'll pause this for a minute. You see my legs are up against the wall. They're about shoulder width apart. And I don't want to be too close to the wall where I'm going to start to tilt my posture. So if you see right here, I'm in pretty darn good alignment. My head and neck are lined up with my torso, and the torso is lined up with my pelvis. Feet are about shoulder width apart. Hips are nice and relaxed. So you want to position yourself where you are the most relaxed. So feet against the wall, or you can put your legs over top a coffee table. So if you had a coffee table here, that would also work as well. But keep those hips relaxed. Your back should be flat on the floor, but not flattened to the floor. Because we have natural curves of our spine, we do not want to actively use your abdominal muscles to flatten your low back down to the wall or to the. That's another cue that many of us have been taught. That's not a correct and accurate cue. That will actually create low back issues, and we'll deal with that in another webinar. So again, I'm set up really well. Now I'm going to go through my breathing. My hands go upon my rib cage. You can do this while you're sitting and listening to this webinar. Place your hands on either side of your rib cage, and I want you to breathe in, and I want you to send your breath all the way down to your lower abdomen and down towards your pelvis. And if you watch my video or watch me in the video, you see my entire cylinder, so my entire core cylinder, my rib cage, my abdomen, and all the way down to my pelvis expands. It's not just belly breathing. We do not want to do just belly breathing. That is not good breathing. That's what a lot of times we get taught in exercise class and or yoga, but that's not optimal breathing. That's just belly breathing, and that's actually a non-optimal breathing strategy. We want the entire rib cage. Your lungs are connected or are placed, positioned from your first rib where the pointer is right there, all the way down to about where the pointer is right here. So the lungs expand this entire area. We want the entire rib cage and the entire abdomen down to your pelvic floor, so down between your sit bones down here. We want the entire cylinder, the core cylinder, involved in the breathing process. So let me play this one more time from the get-go. Position your head and neck properly. Make sure you have that nice long spine position as if you're being pulled up from a string from the back of your head, even while you're lying. Feet are positioned shoulder width apart. Hands go upon your rib cage. You're going to take a breath into your entire cylinder, that core cylinder. The rib cage, abdomen expands top to bottom, side to side, and front to back. You should feel the entire cylinder rise and release. Generally, we want to breathe in through the nose and out through the nose. If you notice, my mouth is closed. I do not want to be a mouth breather. I want to breathe in through my nose and out through my nose if I'm able to. Generally, you want to breathe in for a count of 2 to 3 seconds. So take a deep breath in, count 1, 1,000, 2, 1,000, and then breathe out for a count of minimally 4 to 5 seconds. So if it's 1, 1,000, 2, 1,000, 3, 1,000 in, then it becomes 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000 out. So that way your expiration is minimally almost twice as long as your inspiration. Generally, when we start breathing as well, we only want to do 3 breaths at a time, and do not rush your breath because you will hyperventilate. So do not do this if you're getting lightheaded. Go back to your normal breathing. You never want to breathe to become lightheaded, and you shouldn't become lightheaded because that generally means you're breathing too fast. You're giving off too much carbon dioxide because you're over breathing. And that's what happens to a lot of us, is we are over breathers because we're breathing too shallow and too rapidly. We want to breathe deeper and slower and with less effort. So we don't want to go breathe in as hard as we can and go blow out as hard as we can. We want to breathe in gently through the nose and then breathe out gently as we breathe out. So it's so important that how we breathe is as important as the act of breathing itself. So make it as effortless as possible. And again, if you have respiratory issues, you know that this will be a little more challenging, and make sure you've checked with your medical professional before doing anything like this type of breathing. However, this is the same type of breathing we do with all our patients, even the ones that do have asthma. Obviously, we have to modify it for people that have respiratory issues and or asthma, but it's the same general process. Do 3 to 5 breaths, take a break, go back to your normal breathing. Do another set of 3 to 5 breaths, go back to your normal breathing. And if you can and have time, do a third set of 3 to 5 breaths, go back to your normal breathing in between each set. And I would even check your range of motion, your neck rotation, and your shoulder overhead motion before and after you do this breathing. And almost every single time, you'll notice an improved range of motion. Our second exercise is the Happy Baby isometric shoulder position. So it's basically the exact same position. So we're still looking at our alignment. We're still looking at our breathing. We're still looking at our control here. So now I'm going to use a yoga block here. If you do not have a yoga block, you're going to use a stack of towels for your yoga block. So I'm going to grab a yoga block, place it next to my head. So I'm going to stop this video right about here. So that's the setup. Oops, sorry about that. We'll go back here. So this is a setup position for the Happy Baby isometric shoulder exercise. I'm going to place a stack of towels or the yoga block right next to my head. And let me stop it just for a minute. So you see my hand goes upon my rib cage as I'm working the right shoulder. You notice my elbow is going to be faced straight up towards the ceiling. So my arm is essentially at a right angle. My body is still in the exact same alignment as I was for the Happy Baby breathing. Now, I'm going to take a deep breath into this hand here. So that this hand is just monitoring my rib cage. That I can breathe into the rib cage here. As I breathe out, I'm going to gently push my hand into the yoga block. But as you watch the video, you'll notice that there's going to be no change in my alignment. So There should be no change in your alignment, so you should not be straining, stressing, and or creating any shoulder tension and or neck tension. The biggest challenge we see with this exercise is too many individuals are trying to mash that yoga block into the floor or through the table. Easier is better. When you're trying to improve function, posture, movement, and function, you want to go easier, not harder. So again, that's another counterintuitive thing that we've learned. We always learn that we have to squeeze harder and more and make exercise as hard as possible. When you're trying to improve posture and movement, that's the last thing you want to do, because most of us have gotten strong by muscling movements. What we want to do is make our movement more effortless, like we did when we were babies. So again, I'm positioned up properly here, hand up on the yoga block, elbows facing straight up towards the ceiling. And now I'm going to take a deep breath in. As I breathe out, I gently push my hand down towards the yoga block. Very gently, about 5 to 10% of my effort, and then I relax. I'll breathe in again, and then breathe out and gently push down into the yoga block with my hand. And then one more time, breathe into my hand. And then as I breathe out, push my hand gently down into the yoga block. And here's the benefit of this exercise, is you're still working on the alignment, you're still working on your breathing. Now we're teaching the shoulder blade to start to wrap upwards towards the ceiling, and you're controlling the shoulder blade in a more optimal position, in that upwardly rotated position versus that downwardly rotated position we saw in my patient who had the slumped shoulders. So I'm going to switch sides now and do the exact same thing so you can see it from the other side. So I'm breathing into my rib cage, breathing out, and gently pushing down on the yoga block. Not crushing it, just pushing down lightly with about 10% of my effort. You see there's no change in my neck alignment. There's no change in my rib cage alignment as I'm pushing down into the yoga block. Make it as effortless as possible. We'll do 3 to 5 reps for about 5 to 10 second holds. So 3 to 5 reps, 5 to 10 second holds. Again, our goal here is, now that we've got proper alignment, proper breathing, we're going to teach the proper control of the shoulder blade in that upward rotated position. So in the more ideal position that we want to support upon our rib cage. So now we've got our alignment, breathing, and control. Now we're going to stand up and take that into the upright position for our third exercise. So the third best exercise is the modified wall push-up. So again, anywhere you have a wall, this becomes a perfect exercise. So what we want to do here is, you'll notice as I begin the exercise here, my neck goes long as if I'm being pulled up from the back side of my neck. I'm going to place my hands against the wall. So that's my setup position. If you notice, my thumbs are pointed in towards each other. My wrists are straight. Now, my hands are a little bit higher than we may start with some clients. So some clients, they'll start with their arms lower down or the hands lower down. That's okay too. This is a more advanced position. The higher you go up, the more advanced it is. You can always start with your arms lower down. It does not matter. However, when you place your arms, your forearms against the wall, flat against the wall, as I'm doing here, you want to make sure there's no increased tension here in your neck. So you don't want to strain your shoulders or your neck to get your shoulders into this position. So you're going to make sure you stand tall. You're about a foot away from the wall. Place the forearms upon the wall, thumbs facing in towards each other. You're going to be looking straight through your thumbs. If you notice, I'm looking straight through my thumbs because my head is, I'm visualizing being pulled up from the back side of my head. And this is ideally where we want our alignment. If I drew a straight line through my hips to my shoulder to my head, there's a nice straight line through my entire posture there. So this is ultimately going to be a posture exercise as well. And also, if you like to do push-ups, this is actually the pattern we do with all our clients to ultimately get them to do a push-up in the right position and end in the right way. So from here, now what we do is step away from the wall just a little tiny bit. Again, there should be no stress on the neck, and we push ourselves away from the wall, lower ourselves back down to the wall. And again, if you notice, there's no change in my alignment through the exercise. So I breathe in, breathe out as I go back down to the wall. Breathe in to push away from the wall, breathe out as I push or lower myself back to the wall. And if you notice, there's no change in my alignment through the exercise. I maintain my alignment, my breathing, and my control through the exercise pattern. So I'll turn and face at a different wall so you can see a different angle from it. Align my head and neck, position my rib cage, place my hands against the wall and lower my forearm down, step back away from the wall, extend your arms out, maintain that alignment, that breathing and that control. So breathe in as you push away, breathe out as you lower to the wall. Breathe in, breathe out. Just nice and easy. You're still breathing through the nose, in through the nose, out through the nose. And then you'll push yourself away from the wall. And that is where your posture, your ideal posture should be. Remember, when you're doing any of these exercises, they should not cause you any discomfort, and you should have medical clearance before you do any exercise that's not been approved by your medical professional themselves. So now you have the 3 best exercises: the happy baby position, the happy baby with isometric shoulder position, and now the modified wall push-up. Because our goal here is to create alignment, to create that 3-dimensional breathing using the proper breathing muscles, and to develop that shoulder control. So we teach the shoulder blades to be stable upon the rib cage. Now let's talk about a couple exercises that people do incorrectly that will challenge the exact things that we just talked about and covered. So here's a common exercise that people will do in the gym. So this is a cable row from a high to lower position. So here's the first thing that clients will do. They'll start to overarch their back. And then as they start to pull, you'll see them pull their elbows way far back and their shoulders start to go forward. And as I was doing this exercise, you see that little hollow in the back of my shoulder there. And that was actually hurting my shoulder pretty bad, because that's an exercise I did because that's what I was taught to do early on. And you'll see it from the back side here. They'll overarch their back and they'll jack up their neck. You see that little line right there. It's not so little. You see me crushing my neck right there because I'm squeezing down and back too much. And that's creating a lot of neck tension for myself. So now let's look at the correction for this pattern. So first, I'm going to align. I'm going to monitor my breathing, and I'll make sure I have better control. So here's the exact same pattern, the high to low cable row with much better alignment. Position myself, and it's always important you take a moment to set yourselves up properly before you do your exercise. So much better alignment there. And if you notice, I do not pull my elbows behind my shoulders, and much better alignment and control as I pull. So I pull, and the elbow stays in line with the shoulder and doesn't move behind the shoulder. I'll turn it to the side or to the back so you can see me from the back. So same idea. I stay aligned through my head and neck, nice long spine. I'm going to float my shoulder blades on my rib cage. I'm going to keep that space underneath my arms. I do not overcompress my low back. And you see that nice alignment and that nice space in between. So right there, you see a space in between my elbow and my body. My shoulders stay open and wide. My neck stays nice and long. So everything we just talked about through the webinar, I'm taking into my exercise. So my exercise reinforces the ABCs, that alignment, the breathing, and control that I want through the pattern. And that's how you make your exercises much more functional, and you don't have changes in range of motion and or posture following your exercise. I'm going to show you one more common exercise as an example of how you take alignment, breathing, and control, and how some common exercises lead into neck and shoulder issues. So here's a dumbbell curl, and here's how most people set themselves up. You see the very slumped shoulder position here. You see the extension through my neck, so I have a lot of tension on my neck, and here's how most people are curling. They lift their chest up, and then they watch the elbows. They come way behind the body, and they keep the elbows way behind the body, and that puts a lot of stress on my neck and my shoulders. So that's a terrible position to be curling from and or lifting from. So now what you're going to see me do is I'm going to align, I'm going to breathe, and I'm going to control my position, which is incrementally, I should say exponentially, much harder. So I'm only using 15 pounds, and this is hard for me to do properly. So what I'm going to do now, long spine. Relax my neck, go long through the backside of my spine. I'm going to float my shoulder blades, go wide through my shoulder blades. I'm going to keep the elbows out in front of my body, and that's a much different and much harder exercise than what I was just doing. And I can't do much more than 20 pounds. So 20 pounds is about my max and do it properly. So you see the elbow position much, much better. It's in front of the shoulder. The shoulder is nice and controlled. My neck is nice and controlled. So I'll turn to the rear. So I'll do non-optimal way, squeezing down and back, a lot of stress on my neck. And you see how narrow and tight those shoulder blades are to my body. My elbows are in towards my body. I'm going to start now aligning my body, spreading the shoulder blades, and now much different exercise, much harder exercise, but much safer exercise for my neck and my shoulders. So just easy challenges, I should say, easy changes to alignment, breathing, and control that makes a huge difference in the ultimate function of your shoulder and how much stress and tension you'll ultimately feel in your head and neck. And one thing you always want to do, as we talked about earlier, reassess. Do your self-check first, your neck range of motion, your overhead length assessment, do your exercise, and then recheck your range of motion. Your exercise should never change your range of motion or the ease of your motion. It should, if anything, enhance it. You know if you've lost range of motion or it's become tighter or harder to do it, that you've done something during your workout to compromise your alignment, your breathing, and or your control. Now, before we leave, we have to talk about 3 exercises that jack you up. Number one thing, bench dips. I did tons of these early in my career because that's what Arnold taught me to do. And if you notice here, head forward, shoulders forward. This is a terrible position for the head and neck as well as the shoulder. There's 0 people that should be doing bench dips. This is a terrible exercise for the shoulder, terrible exercise for your rotator cuff, terrible exercise for your head and neck. I like to say oftentimes when I teach, there are no bad exercises. This is a pretty bad exercise. If you have rock solid shoulders, meaning you have 0 shoulder problems, 0 neck problems, 0 upper back problems, you can get away with doing bench dips. But if you're like me, you probably, the risk of this exercise is so much greater than the reward. It's not a great exercise. It will jack your shoulders and neck up. And jack up means you've done something technically not so great to your shoulders. Another exercise that will jack you up, and I did tons of these early in my career, is upright rows. Where you grab a bar, you can also grab dumbbells and just lift them up. It's a terrible position for the shoulders. Again, we never do these with our clients anymore. I never do them personally. And this exercise, just doing a couple reps of this, crushes my shoulders. Because this is the perfect position to create impingement of your shoulder and to perpetuate shoulder issues. So, not a great exercise. Simple overhead press is so much better. So just a shoulder press where you just lift your arms overhead with the dumbbells in your hand. Dumbbells are generally a safer position to lift from than using a barbell. So exercise number 2 that will jack you up is upright rows. And the third one is from front dumbbell raises. And again, I did tons of these as well. The lever arm, so the point from your shoulder blade to the weight is so long, almost no one controls this position. This places a tremendous amount of stress upon the neck and the shoulder complex. Almost no one does them right. And even me trying here to do them right, I'm not really doing them that well. So drop them out of your routine. Safer exercise would be, again, just do a shoulder press. Do other shoulder exercises. They're so much safer for the shoulder than the 3 that I gave you here. And you don't need to hit the front, side, back delts. Every exercise works all your shoulder muscles. You don't need to do front, side, and rear delts like you may have read in some bodybuilding magazines or Shape magazine, or that your trainer told you, like, hey, we worked the front delts, so now we have to hit the rear delts. No, that's just sort of a fallacy. That's something Arnold taught me way back when, but it's not true. This is another exercise that will jack up your shoulders. It's just not worth the risk that it places upon your neck and shoulders. So here are your 3 key takeaways from the webinar, and then we'll take questions if you have questions. The primary cause of shoulder problems is the habits we've created. We've created habits because of things we've been taught from posture, from injuries, from trauma, from surgery, from the way we sit, the way we live, the way we exercise, the way we do activities of daily living. What we want to do is create more optimal habits and not fall back into the way we've always done things. 2, the principles of the integrative movement system. This is how we first developed proper posture and movement, and this is how we use the principles: A, alignment; B, breathing; C, control; 2, redevelop and or maintain optimal posture and movement. When we align the body, the head, neck, rib cage, and shoulders in the right position, we place the joints in the best position. When we breathe, the B of the ABCs is breathing. When we breathe, we use the right muscles, the diaphragm, the muscles in between the ribs. We use our pelvic floor. We activate those core muscles, and we decrease the overuse of the other muscles like our neck muscles and shoulder muscles in the breathing process. Then C, we teach control. How do you control the shoulder blade in a better position? And we went through the 3 best exercises that we use to align, breathe, and control the head and neck, rib cage, and shoulder complex in the right position. And then we showed you a couple examples of how to use patterns that use proper form, and also some exercises that you want to avoid because they really create a lot of shoulder problems. So there you have it, 3 key takeaways. I hope this webinar has helped you sort of understand the shoulder a little bit better, even though it's probably a little bit contrary to some of the things you may have seen, heard, and or read about. If you've worked with us in the past personally, you probably recognize almost everything I talked about in the webinar, and so probably reinforce a lot of the concepts that we've taught you and worked with. If you've not seen us and or heard any of our stuff before, then a lot of this will be new to you, and that's okay. It was all new to me because, like I said, I learned from a very traditional standpoint when I went to, from the time I first read about Arnold Schwarzenegger's book to the time I went to my first therapy class, to the time I took all my rehabilitation classes in chiropractic college, to the time I had to go to therapy. I heard all the same things that we talked about in this webinar, and I've had to teach myself a whole new system to help my own shoulders, and in the process, we've been able to help a lot of people with their shoulders as well. So if you have any questions, we got a few minutes, and we'll take some questions and see if we can help any of you guys if you have any questions and or concerns. So there are no questions. All right, so one question just came in. How do we help our clients achieve better position of the rib cage over top of the pelvis? The thing we start with is we always start with that long spine position. Because when you get that long spine position, as if you're being pulled up from the back of the head towards the ceiling, that almost naturally positions your rib cage over top of the pelvis where it belongs. The one additional cue we use with our clients is they have to stop gripping their hips. So if you're listening to the webinar, stand up and squeeze your butt as tight as you possibly can. Now, a lot of us have been taught that as well. And if you notice, if you've worked with us or seen our videos, we never teach our clients to squeeze their butt either. Relax your butt, and that's the more natural resting position of the pelvis. Because when you think about the right cues, being long through the back of your head, as if you're being pulled towards the ceiling, and you go open and wide through your shoulders, and you relax the gripping through your abdominals and your butt, you position the ribcage more naturally over top your pelvis. Now, some of us have been taught strategies, or we've learned strategies that will flare our ribcage out. What we don't want to do is overuse muscles to change posture. So we don't want to pull our ribcage down with our abdominal muscles, because that will just create other issues. Even though it looks better, it doesn't create more optimal or sustainable posture and or movement and or breathing. Because pull your abs in real tight, hold your abs in tight, and now try to breathe. It's almost impossible to breathe optimally when you're holding your abs in. And again, that's another reason we don't teach people to pull their abs in, because it disrupts optimal breathing. So don't over worry about a flared ribcage position. What you just want to make sure of is that when you're moving, that you're not continually extending your back to move, because a lot of people are flaring their ribcage to make up for a lack of range of motion. And that's why the overhead range of motion is so important, to show you where you truly have tightness and where you're compensating from. You should not have to flare your back or flare your ribcage and extend your back to lift your arms up, but many of us do. So once we get better range of motion, once we get better alignment, breathing, and control, we will have less flaring of the ribcage as a result. The one caveat what I'll say is, if you're of a certain age, and I'm not going to put an age range on it, but we'll say if you've had a flared ribcage for a long time, and now you're older, like when I say older, I'm talking more like your 50s, 60s, and 70s, you may not be able to change your ribcage alignment because your cartilage may deform to that alignment. If you flared your ribcage your entire life because you didn't have great breathing habits or posture habits, then your ribcage can deform to that alignment because the cartilage will start to stiffen as we get older. So don't try to change that alignment. Just work on the best alignment that you can create the best breathing strategy that you can create, and use the best level of control that you can create. So therefore, your body will give you the best it has to offer at this time. That's where also sometimes soft tissue work, manual therapy, massage can also be beneficial to help relax tight muscles, stiff areas, to help the right muscles work and to help position the body in the right place. But don't overuse muscles to try to position the body in a better place. Ultimately, it will create its own set of issues. So I want to thank you guys for taking the time out to join us. I apologize that it did go a little longer than I expected it to, but I just want to make sure that we gave you as much information as we could about the shoulder. If we can help you, feel free to reach out to us at Chicago Integrative Movement Specialists. I want to thank you for watching. We'll be back next month with an additional topic on, I believe it will be the hips. So we'll talk about the 3 best exercises for the hips. And we look forward to seeing you next time. Thanks, guys, for paying attention. And we'll have the recording if you would like to review this, and or if you know anybody that would be benefited from this information, we'll have a recording of this and we'll send you a link out to that as well. Thanks so much. Have a great night. This is Dr. Evan Osar with Chicago Integrative Movement Specialists. Turn the volume on.